Hello, my name is Parag Joshi. I'm one of the fellows here at SCCT from Johns Hopkins Hospital, and I'm delighted to have Dr. Joao Lima, who's one of our faculty and a professor of medicine at Johns Hopkins and an expert in CT. Thanks for joining us, Joao.
Thank you, Parag. This is a great pleasure to be speaking to this blog, since it's the fellows blog is the main blog.
Appreciate that. Could you tell us a little bit about what you're looking forward to at SCCT and what you've seen in the past and kind of what's coming up here in the future as well?
Right. I think this coronary artery disease was the public health #1, right? And what I think we are hoping with CT is that it becomes that tool that will allow us to assess coronary artery disease anywhere in the world, that we can shape it to that degree of flexibility and precision and affordability, because now we are talking at a disease that kills people in Africa, in Latin America, in Asia, in Europe, and continues to be the main killer in the US. So that's what SCCT, I think's primary mission is, to aid in developing those tools and in training young people to further shape these tools to achieve a mission of this magnitude.
Absolutely. And can you tell us a little bit about the work that you do in terms of the research of atherosclerosis with the Core 320 project and where you are with things like that?
Yes. We have, of course, focused on the symptomatic patient. And the symptomatic patient, the question is really obstruction, but we have learned from recently that it's the flow-limiting stenosis that deserves really a real focused attention. So Core 320 is a trial that tries to define that flow-limiting lesion by CT, so comparing CT angiography with CT perfusion, to invasive angiography combined with what we use for clinical practice today in the US, which is SPECT. So if we see an obstruction that is upstream from a perfusion defect, we call that a flow-limiting stenosis in the gold standard, and the question by CT is, can we match that? And the good news is that apparently we can, that CT is able to define quite well the flow-limiting stenosis. Actually, in patients without history of heart disease, the area under the curve is 0.93, 0.94. So it's very precise. In those with stents, a history of heart disease, then the area under the curve comes down more to the 80s as 0.87, 0.86. But this is still, I think, a very potent way that we can address the symptomatic patient, the patient that comes with ischemia. Now, how we're going to apply these knowledge, it's pretty clear that we are not going to do a combination of CTA, CTP on everybody. So it's in patients who we can't make a diagnosis from CT angiography alone that I think we are going to pursue and do a perfusion study. And as you know, we are looking into perhaps implementing this in our own institution, because you have been very involved with the emergency room program using CT, has been a big success, and now we are looking at maybe seeing if we can go that extra step and applying CT perfusion for those that we can't solve by CT angiography alone.
Well, that's great. That's very exciting, and I think we're learning a lot about how CT is really a novel and phenomenal tool in both the asymptomatic and the symptomatic patients, especially with work like Dr. Lima is doing. Thanks for stopping by. Appreciate it. For this and more videos, check us out at youtube.com/firstinimaging.